Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Mai Rodriguez. Today on the program, President Rodrigo Duterte's attack against Senator Gordon is far from over, this time accusing the Philippine Red Cross of blunders in COVID-19 testing. Also, President Duterte allows limited face-to-face classes, but is the timing right amid the continuing Delta COVID-19 surge? And how will teachers prepare and be protected from COVID-19 with the return of physical classes? Health reform advocate Dr. Tony Leachon and Alliance of Concerned Teachers Secretary General Raymond Basilio joins us live. President Rodrigo Duterte wants the Health Department to investigate the alleged false positive COVID-19 test results at the Philippine Red Cross as he once again hits the organization's chairman, Senator Richard Gordon. While President Duterte acknowledges that RT-PCR tests are not 100% accurate, he cites a Harvard article saying that most false positives could be due to lab contamination or other problems on how the lab performed the test. Mr. Duterte then questions the accuracy of COVID-19 figures. Here's the president in his own words.
Are your testing facilities and equipment really as good as you say they are? Because I have heard of many false positive cases from your laboratories. You could be putting more people at risk. You could be falsely adding to the total positive cases per day of this country. Ilan yung nadagdag doon sa positive sa isang araw, daily attack? Na negative, nasali na doon sa numero, napakarami na ang nasakit.
In other news, after almost 2 years of blended learning, some students will return to their classrooms soon, along with their classmates and teachers, following the president's go signal to conduct limited face-to-face classes. The pilot testing will be done in areas classified as low risk from COVID-19. The health and education departments will assess the areas, and parents must give consent on the face-to-face classes. But the question remains, is it safe to do it now that we are in the middle of a COVID-19 surge? Let's go straight to the source of the story. Health reform advocate, former National Task Force Special Advisor, Dr. Tony Leachon joins us live. Good morning, Dr. Leachon.
Hi, good morning, May. Good morning to all the televiewers. Good morning, everyone.
All right, first of all, let's talk about the conduct of face-to-face classes that was finally allowed by President Rodrigo Duterte in at least 100 low-risk areas. What are your thoughts on this? Is the timing right, especially now that we are in the middle of a Delta surge?
I think there's a rational or, of course, a greater reason for allowing the reopening of the face-to-face classes. But I think we need to understand that there should be first a checklist before the reopening. We need to check the ventilation of the schools and install the protective environment in place. That's number one. And then number two, we need to ensure that the teachers are vaccinated as well as the school employees. And there must also be free testings for teachers and students, considering we have a very high positivity rate of around 26%. When the World Health Organization benchmark is less than 5%. And the last one, which I think is very, very important, is that we have not yet started the vaccination for school children or less than 18 years old, even if we have FDA approval for this particular indication. And with the presence of the surge right now, we're averaging 20,000 cases per day. And we have a positivity rate of around 26%. 1 in every 4 will become positive. And increasing number of deaths. an increase in the hospital utilization rate, I think we need first to prepare the schools, the teachers, and the students before we actually work on the face-to-face classes.
So, what are the dangers that you see in allowing face-to-face classes with the current situation on the ground, especially yung mga classrooms natin, alam naman natin, there's poor ventilation, also yung may higher risk na magkakahawahan yung mga bata.
Ang problem natin dito na nakikita ko, yung sa teachers pa lang tsaka sa mga employees, even if vaccinated sila at marami ding unvaccinated, pwede ka rin nagkaroon ng breakthrough infections. Ang ibig sabihin ng breakthrough infection, after vaccination, nagkakaroon ka pa rin ng tinatawag na COVID, lalo na Delta variant. That's why in other countries, kahit bakunado na yung ibang countries, nagkaka-Delta variant pa. How much more kung mababa ang ating vaccination rate in our country? Yan ang isa dyan. Pangalawa, ang worry ko, dumadami ang mga pediatric or mga bata na nagkakaroon ng COVID cases. At alam naman natin na sa Israel, dyan nakita yan, na sa mga cases nila, more than 50% are actually below 18 years of age. So ito yung dapat nating iprepara bago natin isagawa yung face-to-face classes. Naintindihan natin, based sa study sa UNICEF, na it can help the mental health as well as the improvement ng mga bata. But we have to first understand and prepare for the safety of the students as well as the teachers.
So, ang sinasabi niyo po, Dr. Leachon, kahit doon sa mga areas deemed as low risk, pwede pa rin malusutan ng virus? May breakthrough infection na sinasabi?
Yes, kahit low risk ka, kasi ang problema mo doon kahit low risk ka naman, pero sa eskwela, minsan babiolate yan yung ating social distancing or physical distancing. At alam naman natin sa ibang mga public school, hindi maayos ang infrastructure ng mga yan, yung mga physical barriers natin, kailangang maintindihan natin. Pag umikot nga tayo sa mga public schools, makikita natin, miski nga kanilang palikuran or toilets na hindi malilinis at may mga lugar na hindi talaga malilinis, lalo na sa countryside. Kailangan asikasuhin natin to. Kasi ang hirap naman kung mga bata ang magkasakit. Ang laking problema yan. The other thing is the transportation ng mga bata going to that place. Alam naman natin, one of the biggest problem pag pumupunta sa eskwela is mass transportation. Are we ready right now in terms of the preparation natin para ma-prevent ang COVID cases during the transport to the schools?
I understand. Pero, well, the Philippines is among the last countries to allow limited face-to-face classes. Would you say at this point na pag-iiwanan na tayo o hindi tayo pwede makapagsabayan?
Well, ang problema natin, kaya tayo isa sa pinakahuli, kasama Venezuela, Panama sa UNICEF data, huli din naman kasi tayong nagpa-start ng bakuna. March 1 lang tayo nag-start at hindi rin naman rapid ang ating vaccination. Pangalawa, yung playbook natin na dapat free mass testings ginagawa natin, contact tracings, ay hindi natin nagawa. So, in the first place, self-inflicted yung ating problema. Kaya tayo nahuli sa mga maraming bagay. And alam naman natin pag hindi natin na-control ang viral transmission, domino principle yan. Hindi lang naman eskwela tayo mahuli, reopening the economy. Kasi kailangan itong tatlong to, testing, tracing, vaccination rate, yan ang magkakos ng tinatawag na herd immunity. Dati ang herd immunity natin 70% ang target natin, ngayon 90%. So, hindi lang sa eskwela tayo mahuhuli, kung hindi sa pagre-reopen na economy. So, napaka-importante nating makontrol ang viral transmission bago tayo magbukas ng face-to-face classes.
Diyan po papasok ang also to ramp up the vaccination. Ano po? So, how can the government ramp up the vaccination in areas doon po sa mga areas na magpa-pilot test ng face-to-face classes?
Well, isa yan sa didiscuss sa Senado na tayo nag-present at saka sa Kongreso sa Committee on Economic Affairs. Kasi nagkakaroon po ng bottleneck sa pag-approve po ng tripartite agreement. Kung nabalitaan niyo po, naiipit po yung papeles nila doon sa National Task Force at ang gusto ng mga local government unit at saka private sector ay isign na yung MPA na yan or yung multi-party agreement or tripartite agreement para ang mga local government unit at saka private sector maka-order na po sila ng gusto po nilang bakuna. Ang nangyayari po kasi kaya bumabagal po, ang government po with all its bureaucratic delays, hindi po napaprioritize ang ibang LGU, lalo na ho dun sa mga Visayas at Mindanao, at saka ibang private sector na gusto ng umorder ng bakuna. So yan ho ang dapat nating tutukan. Hindi ho naka-bottleneck. Kaya sa Amerika ho, finul approval nila yung isang bakuna para ma-commercialize na at magamit ng mga doktor na ng US military at saka ng iba pang sector. So napaka-importante pong isipin natin na yung rapid vaccination should not only be the domain of the government, but also be the private sector as well.
All right, we have much more to talk about with Dr. Tony Leachon, but we have to take a short break for now. This is The Source on CNN Philippines. Stay tuned. You're watching The Source on CNN Philippines. Our guest today, former National Task Force Special Advisor, Dr. Tony Leachon. All right, Dr. Leachon, let us now talk about the vaccination for children. Of course, may mga nag-aapela na dapat yung mga bata, before they participate in the face-to-face classes, dapat po ma-vaccinate sila. And also, in the latest development on that vaccine front, yung Pfizer po, ang sabi, yung COVID-19 vaccine works for children ages 5 to 11 and that it will seek US authorization for this age group soon. So ano po ang thoughts ninyo?
Well, magandang development yan eh. Na-aproban na, una-una na-aproban na yung 12 to 17 sa Amerika. In-aproban na din dito sa atin yan, mRNA vaccine ng Pfizer. And I think Moderna din. Nagsubmit kahapon ang Pfizer ng 5 to 11 years old na data at hopefully ma-aproban yan para mabigyan protection ng mga bata. Ang problema lang sa atin sa Pilipinas, 56% ng in-order natin ay Sinovac na wala pang pag-aaral para dyan sa edad na 12 to 17 at saka sa 5 to 11. So, paano tayo makakapag full swing ng pagbubukas sa eskwela? 28 million yung mga batang yan. So, dapat ngayon pa lang, umu-order tayo ng marami. At ito sa dapat pinaprioritize ng government. I think humingi ang government ng budget for 25 billion pero hanggang ngayon konti-konti pa lang ang dumarating at yan ay maaring hindi pa sa mga bata ibigay. So kailangan bawasan natin yung pag-order ng Sinovac kasi ang mga R&D companies kasi ngayon ay iniisip na ang paggamit ng mga high-quality vaccine, Pfizer, Moderna, at saka Johnson & Johnson for several indication. Booster doses nga inumpisahan na sa Singapore, sa Germany, sa France, sa US, sa Israel. Number 1 yun. Number 2, paano tayo mag-i-inject sa 12 to 17 at saka sa 5 to 11 pagka dumating yan. Lalo na kung ang inventaryo natin, 56% ay Sinovac and sprinklings lang ng mga high-quality Western vaccines. Dapat sinasama yan sa vaccination program ng government.
I remember nga, you have noted this, na dapat ang kinukuha natin yung mga high-efficacy vaccines, lalo na yung more effective against Delta variant.
Tama yun. Kasi napag-araman din sa Vaccine Expert Panel presentation na na-present ko sa Senado, ang mga vaccines na effective for the Delta variant are the following: Pfizer, Moderna, Johnson & Johnson, at saka yung Covaxin or Bharat sa sa India, kaya bumaba, mga kaibigan, ang cases sa India. Paano yan kung ang in-order natin 56% ng inventory natin ang buong mundo? Ang buong mundo ginagamit ng high efficacy vaccines at may visa sa Delta variant. Baka dapat tingnan natin ang pag-order natin. Kasi pagka tayo na-delay niyan, ito nanganganib na ngayon December 21 timeline natin. At ang people's protection ay 50%. Hindi na yan ang target natin. Ang target na natin ay 90% at mismo Department of Health na nagsabi niya for the Delta variant. So, nangangahulugan, mas marami tayo dapat na bakunang o-orderin. Because of the tight global supply ng buong mundo na mangangailangan din sila because of the Delta variant, nanganganib ang ating supply. At kahit dumating ang Sinovac sa atin, maaaring hindi magustuhan ng ating mga kababayan yan kasi nagbabasa sila. So we have nothing against the order of the Sinovac vaccine, but they have to take into consideration the science, the research and development are actually on the high efficacy Western vaccine, particularly from the USA, and of course, very limited ang research and development and science development sa Chinese pharmaceutical industry. Dapat yan ang iniisip natin.
Doc, quick question lang, since you mentioned yung Sinovac and more than half of our vaccine supply is Sinovac. So may call ngayon si Davao City Mayor Sara Duterte to stop sending Chinese-made vaccines to Davao. Ang sabi po niya doon, yung mga Davaoenos, they prefer Pfizer or Moderna. Your reaction to this po? But will this add to the problem of vaccine hesitancy since, di ba, malaking ang problema yun sa atin?
Well, agree ako kay Mayor Sara na dapat ang in-order hindi Sinovac at Pfizer kasi or Moderna or yung high efficacy. Kasi kung nagba-market survey sila na nakatatlong market survey na, ang gusto talaga ng mga tao yung high efficacy rate, lalo na yung Western brands. So bakit tayo umu-order nun kung tayo nagba-market survey? So agree ako dyan kay Mayor Sara Duterte. Huwag tayong umorder na hindi gusto ng taong bayan. Kasi ang gusto ng LGUs, gusto ng mga private sector, ay hindi Sinovac. Based yan sa mga surveys, based yan sa mga discussions natin sa mga pasyente. Masasayang lang yan at mag-i-increase ang vaccine hesitancy natin kung ipipilit natin yan. At kung hindi tayo gagawa ng paraan, madidelay yan. So I agree with Mayor Sara Duterte.
All right. Thank you for your time this morning, Health Reform Advocate Dr. Tony Leachon. We'll talk more about the pilot face-to-face classes when we return. Alliance of Concerned Teachers Secretary General Raymond Basilio joins us live after the break.